There is no doubt colon cancer is a huge problem, and we're going to talk about it today here at Hematology and Oncology Associates of Northeastern Pennsylvania on Mead Street in Dunmore with Dr. Kishori Viradrappa. Dr. Kishori, thank you for talking with us today.
Thank you so much, Dave.
So when it comes to colon cancer, let's begin with the size of the issue. It is a real big problem.
Of course it is. As you know, colon cancer is, barring skin cancer, colon cancer is the third most common cancer in the United States in both men and women. Although, the death rates from colon cancer has been decreasing in the past 20 years, thanks to colonoscopies and also improved treatment options.
When it comes to those at risk, who are the people or what are some of the behaviors that put people most at risk?
Age is an important factor. 90% of colorectal cancers develop after the age of 50. So 50 is like a magic number where the risk of colon cancer increases. Lifestyle changes like obesity puts you at a higher risk. Higher consumption of alcohol increases the risk of colon cancer. Smoking, as you know, it increases the risk of other cancers, including colon cancer. Consumption of processed meat is also a risk factor. And of course, familial causes. If you have a family history of colon cancer, then you are at risk of developing colon cancer too.
All right, so those are things to be on the watch for. And when it gets to possibly developing colon cancer, there are some signs people may experience that may be, warning to them. So what are things people should be looking out for, some symptoms that they could develop?
Yeah, people definitely have to go for screening colonoscopy before any of these warning symptoms develop. But if you see that you are fatigued, if you are tired more often, if the fatigue doesn't go away, that's one of the warning signs. That could be a sign of anemia, which comes from blood loss. And then, of course, if you are anemic and if you have iron deficiency, that's also one of the concerns that we have to look for any evidence of malignancy. Also, if you're losing weight without you wanting to, that's one of the reasons to go see your physician. If you have persistent abdominal pain, change in bowel habits, if you're having diarrhea, constipation, and that's not your normal, that's something that you have to look into. So a lot has changed and a lot is changing. We have a lot more medications and we can take care of patients better.
Right, and that's what it comes down to. Colon cancer, no doubt a big problem, but they can help here with screenings and treatment at Hematology and Oncology Associates of Northeastern Pennsylvania. And for another information, our viewers, they can either call the office or visit you online.
Of course, yes. We are always available. Anybody can reach us 24/7. Our number is 570-342-3675. They can also visit us on web.
All right, that is a plan. Dr. Kishori Viradrappa from Hematology and Oncology Associates of Northeastern Pennsylvania here in Dunmore. Thank you so much.
Thank you so much for having me, Dave.
Well, are you ready for some baseball? Because despite today's rainy weather, the games